I'm going to be sharing with you a wellness toolkit that was developed during the Get Groove project. You're going to notice throughout the rest of the conference that many of the items that are discussed here have been discussed previously yesterday and will be discussed today and tomorrow. So you'll see a lot of commonality and overlap in this wellness toolkit and the other tools you're learning to use. Now we'll start by saying that when we started with the Get Groove project, we had a very small, reasonable goal. We just wanted to change the world for the better. Our plan was to have an intervention developed using social media and environmental change using a peer-led and community-based participatory research model. This was a project funded by the USDA through the National Institute of Food and Agriculture's. We had many different partners involved in this project. You can see here, again, a number of the names that you've met during the conference and will meet soon if you have not already. We had intervention sites. We had 4 intervention sites, the University of Tennessee, South Dakota, University of Florida, West Virginia. We also had 4 control sites, Auburn, Kansas, University of Maine, Syracuse, and then we had a number of consultants and collaborators from the University of Nebraska, New Hampshire, Rhode Island, University of Florida, and Rutgers. Amazing, wonderful collaborators. All together, we had about 40 PhD researchers and over 1,000 students working on this project to develop this intervention that brings to you today this toolkit. I'd also like to say that one of our key players in this process was our amazing biostatistician, Dr. Wenjun Jo from University of Tennessee. I really appreciate all that she did to help guide us and keep things moving along. So what was the goal for the project? Well, we wanted to help our students, especially our first-year students as they come to college, live a happier, healthier life. And this had 3 main pillars of physical activity, a healthy diet, and a stress reduction plan. This was not a weight loss project, although it was funded as a childhood obesity prevention project, and the goal was ultimately to reduce the amount of unwanted weight gain in the first year at college. Because the intervention was focused on the overall college campus, there was no specific singling out of incoming first-year students that would be obvious to anybody involved, but that was what it was developed in mind with. But remember, obesity prevention is not the same thing as weight loss. It was about just living a healthy, happy life, and that positive weight management and prevention of weight gain, unwanted weight gain, would naturally come from just living that life and being aware of our environment. So it really did address all aspects of life. If we want to make real changes in weight outcomes, we really just have to recognize that what we eat and the impact that has on us and how physically active we are, it's all components. It's everything intertwined. It's everything interacts. So from diet to physical activity to stress management to also sleep and substance abuse prevention and peer relationships and academic success, all of these things are intertwined. So how can a bunch of people running around in fruit and vegetable costumes possibly change the world? One thing that's important to note is this was a community-based participatory research model. So throughout the project, this was a partnership with our community members, and in this case, our community members being students. So we had our faculty researchers, extension professionals, undergraduate students, graduate students, postdocs, everybody was working together as equal partners. No hierarchy there. Always remember that when you're working with a community, the true experts with the most knowledge about community issues and community behaviors and what will work in a community is the community. So we all just bring different skills to the table and work together. And when we do that, we have more relevant, effective, and sustainable outcomes. So our college students were equal partners throughout this. And we developed partnerships, and the more you can do that, the more long-term success you can have. This was a social marketing and environmental intervention. What the students and the faculty and extension professional partners came up with student-led. I would say that although we're all equal partners because of who's bringing what information to the table, we really let the students lead the exploration and understanding what needed to be included in an intervention that would help students to be healthy on a college campus. And this is what the students identified. They again identified those 3 pillars of stress, diet, and physical activity. Under stress, they had identified issues of time management, friendship, music, meditation, sleep, positivity. Also under dietary, they had issues looking at my plate and knowledge and fiber and portions and hydration, flavor, exploring new foods. And under physical activity, they thought that it was important to include strength, flexibility, dance, yoga, cardio, and walking. And they also had included healthy body image, substance abuse, thankfulness, and maintaining behavior as other units of focus in their toolkit that we all created. But there were 24 weekly topic areas that you'll find in your wellness toolkit that you have access to. So here are just some examples of some of the student developed work that was used in that social marketing piece that communicated about health. And we'll just flip through some of these amazing, wonderful visuals. And you can really see the creativity when we rely on our community partners and we trust our community partners. The outcomes can be phenomenal. So it's also much more relevant when we have students who are developing the messages for students as opposed to non-students outside of the community developing messages that would be relevant. And some of us, we're no longer young as we once were. We may not know what's cool, and we may miss the mark. Whereas if we really are working with our partners throughout, we have a much better chance of being relevant and well received and interesting and making the impact that we want to make. So what does the Wellness Toolkit walk you through? Well, first of all, the very first step in this process, you'll see if you decide to take this toolkit and implement all of it or some of it on your campus, is that there are surveys that need to be done and there are environmental audits need to be done. So again, you see here how this fits with the rest of the conference that you are learning about. So these online surveys are available to you. In just a moment, you're going to hear more about how the online surveys can produce this wonderful wellness report card that can be an automatic output of the surveys. When they take it, it can automatically populate these PDFs and send them by email. So you'll hear more about that process in just a moment. Some of the other things that you are going to be hearing about the rest of today and tomorrow is some of the EB forecast, College Environmental Perception Survey, Readiness to Change Survey, Student Priorities Survey, College Health Programs and Activities Survey. Also, making sure that you do that Healthy Campus Environmental Audit, which will include areas of policy, built environment, environmental factors, including food environment. So once you do those surveys and environmental audits that we'll be talking about for the rest of the conference, the next step is you take that information that you gather and you meet with other health-related organization leaders on campus. That's a very important thing to start working on. That coordination was one of the key things that came out of this project that we learned. There's a lot going on campus, and often it's competing between each other, so you're wasting resources with that competition, especially when you don't coordinate and find synergy and build upon the efforts and the work of teams that have similar goals. Another thing that beyond the health-related organizations that you know are already very interested and invested in health is that you need to have town hall meetings where you share back what the data you've collected and what the organizations are thinking with the general student, faculty, staff, administration, everyone on campus, and give a chance to have that dialogue back and forth. You want to make sure that you're meeting with administration throughout this process. And you'll see these numbers here. This means that we asked in the wellness toolkit that the student group that had the faculty and staff and extension professionals working with them had at least 3 meetings with those health-related organization leaders, but it can obviously be more. The town hall meetings to have at least one of those meetings, for meeting with administration to have one, health promotion activities, at least 4 activities planned throughout the year. And again, those are looking, once you meet with those other health-related organizations, there's a process to identify what's currently being offered and planned for the year, and looking for those gaps that you might want to fill based on what's available in the toolkit, and then having at least 4 of those, and then trying to have a market health that could be from your group, it could be with other groups, and health-related activities through social media with at least 1 messaging a week. And then to conduct some ripple mapping focus groups at the end of the year to see how things went and to see what the possible impact is, as well as having those online progress reports that students can then use to track their own wellness behaviors over the years while they're at college. So I know we're running out of time. Here are just some images of showing you what it looked like as it was implemented on campuses and students being involved. It was a lot of fun and a lot learned and shared. A lot of different campuses involved. And just to let you know, so remember, unwanted weight gain was the primary outcome, and propensity score matching and counterfactorial modeling was used to look to see whether we reached that outcome after we adjusted for age, gender, race, ethnicity, baseline BMI, baseline stress scores, and dropout propensity. We did find that the weight of the intervention groups on average increased about 0.77 pounds less than our control groups, which was statistically significant. But did that really change the world? I think I had to learn that that's a very lofty goal. And instead of trying to change the entire world, and that can be a little frustrating when we have these small positive movements, but not as big as we want, sometimes what we have to do is wait for that ripple effect. That if we each are out there trying to do our best to make changes that improve our little corner of the world, it will ripple out, and together we can change the whole world. Well, I hope you enjoyed learning a little bit more about the background, where these tools came from, and about the toolkit that can be used to guide the assessment of the healthfulness of your campus, and then also provide a framework really for developing an intervention that works for your campus. The intervention that is available online in the toolkit is open for anybody to use. And feel free, because it was created a few years ago and things change rapidly especially for our students. I'm sure that your students at your campus would want to make their own social media posts and messaging. And so it's really meant to be just that framework that you can layer, and it grows, it evolves throughout time. It's not a static item. So if there are any questions about that, please enter them into the general chat right now, and I will be happy to answer them. Otherwise, I will move on in just a moment to our next presentation. All right. Well, I will, for the sake of time, since it is a little bit tight on the time anyway, I will go ahead and move this on to our next, you'll see that our next 2 presentations, and then we'll take questions at the end after those. So you'll see Chelsea Allison will be our next speaker, and I'm very excited to introduce her. Chelsea Allison is an assistant professor of nutrition and exercise science at Springfield College in Springfield, Massachusetts. She graduated from the University of Tennessee in Knoxville in 2021 with a Doctor of Philosophy in Nutrition Sciences and a concentration in community nutrition. She completed her dietetic internship in 2020 and took her exam to be a registered dietitian in 2021. Her research interests include disordered eating, body image, and diet culture through a lens of health equity and food systems. She is currently receiving her certification to become a certified intuitive eating counselor. And without further ado, I will turn this over to Chelsea.
Hello, everyone. Thank you for having me for this session. Today, I will be talking about the Wellness Survey. And the Wellness Survey incorporates a collection of four more individual surveys that we use to assess four health behaviors that were identified as priorities for actually college students who we were working for, or the population that we were working with. So let's get started. So today I'm going to talk about the purpose. Why did we do this wellness survey? How did we conceptualize it? I'll talk about the survey items themselves, and then talk about uses and future implications. So we wanted to assess the main health behaviors of college students. And in order to understand why, I have to move forward to conceptualization. So in our first year of the Get Proofed project, we had a class. So we were recruiting undergraduate and graduate students to be part of this SMEI class. So SMEI stands for Social Marketing and Environmental Change Intervention. And so we were looking for students to be part of this course. So from here on out, I'll refer to them as SMEI students. And these students were from four universities, so South Dakota, West Virginia, Tennessee, and Florida. And these students were enrolled, and we really wanted them to identify intervention strategies for change, where we focused on social marketing and we focused on environmental change and health promoting activities on our college campus. And we were really focusing on the first year college student based on a lot of the literature that made up this project. And so when these students were going through the course over the semester, they really did a really wonderful job at prioritizing and identifying what health behaviors do they constitute as the crux or the foundation of good health and good health promoting behaviors to have a successful college career and education. And so in doing so, they identified those four main priorities. So let's move on. And these are eating healthy, right? Nutrition, being physically active, managing stress, and getting quality sleep. I'm going to go over each of these tools. I'll tell you what tools we use to assess for the entire wellness survey, and then we'll go into each of them individually. So first, we did our NCI fruit and veggie screener. So that's the National Cancer Institute fruit and veggie screener. Again, we'll talk about that in a little bit more detail. Then for physical activity, we used the IPAC tool. We did perceived stress for managing stress, and for getting quality sleep, we asked a one-item sleep question. So first, for the National Cancer Institute, for the National Cancer Institute Fruit and Vegetable Intake Screener, we wanted to measure, what is healthy eating? And so we wanted to look at average fruit and vegetable consumption. The literature shows that college students typically don't eat the recommended 5 servings of fruits and vegetables per day. And so we wanted to use this as a marker for overall wellness and well-being. Now, this survey includes 19 items that all include about how, what types of vegetables do you eat? What types of fruit juice do you drink? Do you ever have pasta sauce? That constitutes to a tomato, right? So different vegetables from different foods. And so participants would share their frequencies and their reported intake of those different foods. And this screener would actually pump out an average daily fruit and vegetable intake that we would use as part of our wellness screening. Next, we used IPAC, or the International Physical Activity Questionnaire, and we use this to measure physical activity. This survey only includes 6 items, so it's pretty short and pretty easy. Participants will report their health-related physical activity, and the output were in METs, so total metabolic equivalents. And now METs is very prominent in exercise science and kinesiology, but for those of you who may not know, it represents a simple, practical expression of energy cost of physical activities as a multiple of the resting metabolic rate. And so it pumps out a number, and you can look at how your METs compare to others. And that's how we used it. And I'll talk more about that when we talk about the wellness report. And so participants would answer questions about their moderate physical activity or their vigorous activity, or even just walking in the last 7 days. They would report how many days they would do that in the last week, and then how many minutes. And then that would pump out a total metabolic equivalent, or a MET score. To measure stress, we used Cohen's perceived stress scale. Now, this survey has 14 items, and participants report their frequency of stress-related and feelings and abilities. So this would pump out a perceived stress score, and the higher the score, the higher the perception of stress. So some questions might ask about, in the last month, how often have you felt nervous or stressed? And participants would be able to respond as never, almost never, sometimes, fairly often, very often, or they would choose not to answer. Some other questions might be, in the last month, how often have you felt that things weren't going your way? Different questions like that. So how are people perceiving their stress? It's going to impact their overall wellness. And then for sleep, we just asked during the last month, how many hours of sleep do you get? And we prompted not how many hours are you laying in bed, but how many hours are you actually asleep? And this question can be difficult over the last month, but just giving an average can help us gauge, whether students are getting enough sleep, too much sleep, or just the right amount. And so they would just report their average hours of sleep. And of course, the output would be hours of sleep for us to understand their overall wellness in this area. And so those were the 4 priority health behaviors. And we felt that, this was a really great way to capture overall wellness for our participants. And, the great thing about a wellness survey like this, we have new tools and measurements that come up all the time. So we can easily kind of change things depending on if we have different tools that maybe we validate or develop, or something else that's coming up in the literature. So for uses and future implications, as we'll go over in just a few moments, this is part of a wellness report. So we use this as an automated kind of a report card for participants for our research project. And so using some sort of, collection of these 4 health behaviors can really give us more of an overall picture of our participants. And again, like I said, the tools might be modified. You can modify them to fit the needs of your research, or if you're a practitioner, you can also modify to fit the need as a practitioner, and always add additional surveys as well. I'm happy to answer any questions, or if you would like any help, I'm happy to help and guide as best that I can. I have my email there, and I look forward to hearing from you if you need any help. Thank you so much, and have a wonderful rest of your day.
Great. Thank you, Chelsea. And actually, we are going to just turn this right back around to hear a little bit more from Chelsea. So I will turn this over to that presentation, and then we'll take time for discussions and questions as time allows.
Hello, everyone. Thank you for having me. Today, I will be talking about the wellness report that we developed for the Get Proved project. And I'll also show you a little bit about the behind the scenes in the Qualtrics platform that we used to create this report. So I'll talk about the purpose and the conceptualization. I'll talk about the wellness report itself, the tutorial I promised, and then uses and future implications. So our main purpose was to provide participants with immediate feedback on their health behaviors. We had identified those 4 health behaviors that I discussed in the wellness survey session. So healthy eating, physical activity, stress management, and sleep. And so we wanted to give that immediate feedback. So our participants are taking this survey out of the goodness of their hearts, maybe for a small incentive or stipend, but being able to give them immediate feedback through a report was something that we wanted to do as an extra intervention piece. And we'll talk a little bit more about as we go along. And so we wanted to give them scores. So how many fruits and vegetables did they report consuming? And what is the national recommendation, or what is the national college student average consumption of fruits and vegetables? And then what are the recommendations set by the dietary guidelines for Americans? Now, of course, the participant scores will come from the participants themselves. So we used Qualtrics as the survey platform, and it also was the platform that pumped out that wellness report. So we had to do some math and algorithms behind the scenes to give them that immediate feedback that we didn't have to manually do. And then for national college student averages, when we first started, we really looked at our surveys and our participants before we did this wellness report, and also in the literature. And then after we gained a little bit more data, we collected data from 60 universities and colleges in our randomized controlled trial, and we used those averages from almost about 8,000 participants. And so they were a pretty good representation of college students around the country. And so that's where those scores came from later on in the project. And then, of course, recommendations came from the most updated dietary guidelines for Americans, or the literature if, for instance, stress and sleep were not included in those dietary guidelines. So as mentioned during the wellness survey session, we had our eating healthy foods that was measured by the NCI fruit and veggie screener. IPAC was used to assess physical activity, perceived stress score for managing stress, and then just that one item sleep question: how many hours of sleep have you had in the, a night in the last 30 days, to understand if our participants were meeting the recommendations and getting quality sleep. So our process, we created this wellness survey, and participants would take our survey after they would consent for their data to be used. In the survey, they entered their email address, and this was used as to help start tracking our participants, pre and post. And then we use that email address to send them their wellness report immediately after they were done their survey. Again, so this was immediate feedback within, you click submit, and then within the next minute or so, a wellness report would show up in their inbox. And so this is how the wellness report looked. And so you can see here on the left column, this was the national college average for average fruit and vegetable intake, how many cups, the average physical activity, so those METs that I was talking about during the wellness survey session, the average hours of sleep that college students typically get, and then the average stress score. And so that was about 24, and you can see all the way to the right, the recommendations. So those columns were the recommendations based on guidelines and the literature. So fruit and vegetable intake, you can see here, we don't collapse the fruit and vegetable intake, in the left 2 columns. However, we wanted to show, fruits versus veggies. And then for METs, we kind of explained METs a little bit, because unless you are in that field, you may not understand what that means. And so a minimum of 5 to 1,000 METs minutes per week is what is recommended. So participants can then compare their MET minutes per week to this recommendation and to the average college student. And then average hours of sleep. Pretty easy, right? It's that one item question. And so 7 to 9 hours per night for 18 to 25-year-olds, which was our priority population age range. And then for our score, our perceived stress score, there wasn't a recommendation, but we did, mention that if your score is high, try to find ways to decrease your stress levels. So you can see here, I did a little demo, and this is not my perceived stress score because I kind of just clicked through to make this wellness report for this presentation. But a score of 31 is much higher than the average stress score. And I mean, you can get, a very, very low perceived stress score if that's how you perceive your stress. So. And then so another really cool function about the wellness report is we also had hyperlinks. So to find more about your, how to reduce your stress, click here. And this was a document that would pop up if participants wanted to start tracking down and making SMART goals for themselves. So in addition to giving them direct and immediate feedback to their health behaviors, we also wanted to give resources and easy things that they could do in order to help promote their health behaviors. So again, another piece of the intervention that is very easy to do, and something that, I think students really enjoyed seeing over time, or even just a quick snapshot. So I'm going to switch my screen here. So bear with me one moment. Okay, so let's see. Here is the Qualtrics interface as I see it from behind the scenes. And I do want to note that Qualtrics has changed pretty immense, like their organization has changed a lot since we did these wellness reports. So if I seem like I'm stumbling for a moment, I have looked and tried to practice this, but if I do stumble, this is why things are a little bit different. And so you'll see here, if you've never used Qualtrics before, I would definitely recommend getting with your institute's technology office or center. Sometimes they will have somebody who's an expert in Qualtrics. They also have wonderful tutorials online, and they have pretty good support, I would say, like live support if you need it. But a lot of times just experience and playing around with things is really a good way to kind of understand the nitty-gritty of Qualtrics. But overall, it's a pretty useful platform. And not all institutions may have this. There may be other ways to do this type of report. If you don't have Qualtrics, I'm just not super familiar. So I think you could always bring this question and this idea maybe to your tech people at your institution if you don't have Qualtrics, and maybe they can help you figure out a way to do this. So let's get going. So here you'll see I have my 4 different health behavior surveys. So we have stress, right? We can see how stress is organized in the survey. We have sleep. We also had personal information. So this was collecting demographics. And this is where students would actually enter their email address. We always ask them to, do their email address twice, and would have it validated to make sure that they were actually entering a correct email address, or they put the same email address before they could move on. And like I said, as soon as they were done the survey, this wellness report would get triggered to this email address immediately. All right, checking my time. So from here, you can see we have a lot of surveys. And to make our lives easier, we need to score a lot of things behind the scenes. So we first have to score our surveys, and then we're going to have to write some code in the background in order to make our wellness report come alive. And so a lot of times it'll be found under tools. Maybe not. See, things have changed. Okay, so I came over here to the survey option. And you can see here scoring. So you click on scoring, and it takes a minute because it's kind of its own little entity. And here you can do stress. Again, if you do not know anything about Qualtrics, it's recommended to find somebody who does to help you do this, but you can create new categories of scoring. But for like fruits and vegetables, for instance, so the NCI fruit and veggie screener, we have to score each question, and then we put the total score together. So for the first fruit and veggie question, I'll show you where we've scored. Oh, now my computer is not responding. Here we go. So I am looking for my fruit and veggie screener. So I have scored based on the scoring instructions that were given to us through the NCI website. So they've given us how many, the score for this, and this is the only question that's scored. So it's going to give me a variable and it's going to give me a score. And so all of the fruit and veggie items are similarly scored. And I wanted the individuals so I could kind of play around with different items. So I'm going to go back to my survey builder. And so I have those individual fruit and veggie scores, but I also need to write some code. Now there's a thing called survey flow here in Qualtrics, and this can get pretty technical. So again, asking for help is great. And so you'll see here, here's our fruit and veggie 1. This is going to be our score that's generated, and then we're going to multiply this with another score. Again, this is all code. Sharing my code might not be super useful because it may have different, it might pop up very differently than you. I can always share this survey, and all of the scoring and code will already be included. So if you would like the scoring and the code, I can share you this survey, no problem. So just let me know. But there is a lot of code that will help us create our wellness report. And so once we're all done with our code, we will go over to, now let me make sure it's changed again. So we're going to go to post survey. Okay, and then we see here manage email triggers. Now this is what will email our participants as soon as the survey is done, and you can do a whole host of different things. So it's pretty interesting and pretty cool, but you see here we have this already. So when and this tells our computer or our platform, our survey, that when the question and they have consented and they have continue is selected, then you can go ahead and email this email address, and this is the code for their email address that they've entered. You can change what the name is or who it is from. So we would say get Frooved, but you could change it to Chelsea Allison, different things. And then your subject can be whatever you want. Now we have our document here, our visual that I showed you in PowerPoint. And this was imported we imported text and pictures in Qualtrics, and we put them in here, and you can see here we have code. So whatever the average intake that we included in that survey flow will show up here. Now, whatever score for fruit and vegetable that the participant reported through their fruit and veggie intake survey will be reported here. And then we have our recommendations that kind of stayed static. And then you can also see down here, we have our hyperlink. So for tips on improving your wellness score or to download a goal setting worksheet, like I showed you, you can click here. You can see here that I can send immediately or I can send in a few days. And that's about it for those triggers. So it can be pretty easy and you can modify it in any way that you would want. But that is a really cool, innovative way to get that immediate feedback to your participants. I'm going to head back to my PowerPoint. Oh, excuse me for a moment. And so this is an innovative tool, like I just mentioned, and an additional incentive for research participants, and it can be used in various settings. I think you could get so creative with this and be able to provide resources, but that immediate feedback to your survey participants can be priceless and really you know, I don't know what the word is I'm trying to find, but be different than the rest. So I think it's a really wonderful tool to have. Please email me if you'd like me to share this survey or if you have any questions. Thank you very much. Have a great day.
So as you can see, Chelsea is absolutely amazing. Dr. Allison is one of the most proficient individuals I have met and that I know with Qualtrics. So if you do have problems, I'm not saying we can overuse Chelsea's resources as a one-on-one Qualtrics guru, but I'm sure she's willing to help. Qualtrics is really an amazing tool, and there probably is somebody on your campus who's the Qualtrics expert. And that Qualtrics expert here at UT was the person that Chelsea worked with for years, until that Qualtrics expert said that Chelsea was actually beyond her, she had exceeded her level of expertise. So I hope for each of you that you find that partner on your campus. Sometimes instead of reinventing the wheel and learning new tools, if it's better to build a team of people with resources that fill those gaps. So I encourage you to look into that if you have any use. So we have just a few minutes for questions. If there are any questions, please put them in the chat now, and I will do my absolute best to answer your questions. Okay, so hearing none, I assume that means it's everything is very straightforward and exciting, and we are going to be moving on in just a few minutes. I just want to kind of reiterate that what this morning session has done, hopefully for you, is giving you a nice overview for the rest of the conference, and that it'll kind of show you how those pieces hold together and can be used. I encourage you to go to that nutrition department website, which I'll put that website in the chat in just a moment again, and take a look at the tools that are available there. Go ahead and download the Wellness Toolkit, because it does provide you that outline of how these different tools that you're hearing about can be used together to produce something. So what's really important as we assess our environments, it's because it gives us the ability to hear from multiple partners what needs to be done, what's currently happening, helps us to understand that, and helps us to then give back that information so that we can then as a group discuss what we found, and you'll see, set your own priorities and decide within what resources you have, where to allocate your resources and how to move forward. So without having that assessment phase, whether it's for research or whether it's for program development, if we do not have that assessment phase and we're just moving forward with what we think needs to be done, we can be wasting our time, all sorts of resources, time, of course, being an important resource, and not having the impact we want to have. So that is why we've spent so many years developing the tools that we've developed, so that we all can take that time. And by using the same tools across multiple campuses, we can better work together to compare and see what's happening differently on different campuses, to see patterns of where things are working well, and to be able to track changes as we do make and implement changes in the environment and in programs and in policies. So these tools are not only assessment at the very beginning before we get going, but it's also a great opportunity to use free tools to assess and track what's happening from your efforts. So I encourage you all to go ahead and download that if you haven't already. It will give you that overview of all the different tools that we're talking about here, and then you can start to make plans for your own research, classes, or campus.